Every month that you delay a diagnosis, there's a 10% increased risk of mortality. Healthcare as an industry is about a decade behind. This device is the most important medical device of the 21st century.
Firstly, again, just thanks so much for popping in. So I think it's 7 years in the making. I was actually sitting down in a meeting. Leo Clancy did the first introduction. You have had a pretty interesting career overall. Would you mind just telling me a little bit about how you got into this world? What's been your journey to date?
Great, Mark, and it's lovely to meet you after 7 years, and you're doing amazing work just evangelizing and promoting the AI ecosystem here in Ireland. I've been privileged. I'm an electronic engineer and had great opportunity to work with amazing companies, with Philips, with GE, with Intel, and MasterCard. I spent most of my career at Intel, and I ran global digital innovation. I also ran our Intel Labs Europe network and had amazing opportunities. And what's always motivated me is the power of technology to not only drive profit, but also purpose and make changes. And particularly at Intel, I had the real opportunity to use technology for transformation, and I was privileged to work under an amazing CEO, Paul Otellini. He had a vision for Intel that was not just about creating and extending technology, it was about connecting and enriching the lives of everybody on the planet. And after MasterCard, I went to the HSE. I became the CIO, and it was quite challenging. But I'd written a book, actually, doing some work with the European Commission. It's called Open Innovation 2.0, and that's a methodology for driving structural change in industry using digital technology. So in the HSE, which is Ireland's equivalent of the NHS, I was using that methodology as digital transformation and open innovation director to try and drive a digital change in the health system. I worked with some amazing clinicians, from hospital consultants to nurses, and we got a lot of change. I had the privilege when COVID came, I was able to lead the HSE's digital response, and we had some amazing solutions. Like in 48 hours, we had a remote monitoring solution for COVID-19. We also had one of the first solutions in the world for measuring real-time respiration rate of COVID patients. And in some cases, that was life-saving. We're getting up to 12 hours notice of a patient desaturating. I made a decision 2 years ago then to move back to Maynooth University. I'd founded the Innovation Value Institute there 18 years ago. And actually, the government sponsor at the time was Micheál Martin, our incoming Taoiseach. He was the department or the Minister for Enterprise then. So what I'm doing at Maynooth now is driving what we call a guided open collaborative ecosystem for digital health. I feel there's a real opportunity to have a metamorphosis in our global health systems. Now, in Ireland, we're particularly challenged because we're very far behind in digital. Healthcare as an industry is about a decade behind other industries in digitalizing, if you look at music or banking or retail. But unfortunately, Ireland is even far behind. And I had to make a decision when I was in the HSE, based on what I was observing, the resistance from high-level administrators, strategy administrators, but also the academic literature was saying, actually, a really good way of driving change to systems like this is from the outside in. So what I'm doing is running or orchestrating what we call a guided open collaborative ecosystem. And some academics from Milan, Politecnico di Milano, Gestalt, they talk about OCEs as a fundamental mutation in the business competitive landscape. So this is a new business form where we have actually everybody working together in a high trust, high capability environment, all towards a common goal. So that's what I'm trying to do. And my mission really, it's about education, it's about exploration, and ultimately then exploitation of new solutions, integrated solutions that improve health for everybody, empower people to manage their health better, and make systems more efficient and effective.
I remember growing up, and when I did my master's 20 years ago, GE, Intel, they were always the poster child for innovation, being in the top 1, 2, driving performance, increasing that benchmark. I'm guessing you mentioned the CEO of Intel. I'm guessing they probably rub shoulders. You're rubbing shoulders with so many different types of influential people and in kind of motivated people. Did that shape you in terms of what you then brought into the HSE?
Yeah, very much so. And again, one of the things I learned, I used to play a bit of soccer. You get better if you play with better players. So I had the privilege, like for example, you probably heard of Moore's Law. But when I was promoted onto Intel's global staff, I was the global director of IT strategy and technology. My first extended ESM meeting, Gordon Moore came up to me at lunch, and we sat down and had lunch together. That was amazing. I've had the opportunity to, interact with Bill Gates at Microsoft. I actually followed Steve Ballmer as a keynote speaker of a big Microsoft summit. And that was actually really easy to do because Steve Ballmer is great, but he was talking about incremental innovation in Excel, and it was very easy to follow him. But you do get inspired. The better the people you work with, the better you become, and we all work together. So that certainly has inspired me. And when I was at GE, Jack Welch was the CEO, and obviously, very prominent CEO and very prominent management thinker. You have to be number one or two in your industry, or we're going to sell you. So
Which is incredible pressure when it's so hard even to get into this certain kind of top 10, top 20 of any type, and then to be one and two.
yeah, but coming back to soccer, it's much easier to be playing for a team that's trying to win the championship or the premiership rather than fighting relegation. Again, I was with Philips, and I had an amazing opportunity as a young engineer to go and start to work in the Philips Nat Lab, which was, any aspiring electron, everybody wanted to work in the Nat Lab. But the funny story is I only actually worked there for half a day, because the day I started, the division I worked for, the Center for Manufacturing Technology, actually moved out of the Nat Lab to another campus. But working with great people, you get better and you help them get better.
How do you make the transition then to the HSC, which is decades behind, different type of mindset. So many different types of cultures within a culture, and then you're trying to bring in digital transformation, open collaboration within a culture that's not prepared for that. What is that like? And add in a sprinkle of COVID, what does that become?
Yeah, no, that's great. So let's answer it in two parts. So a lot of it's down to culture. So it was a major culture shock coming into the HSE, but there are still amazing people, consultants and nurses that are driving remarkable innovations, like people like Michael Sugru, who is a breast surgeon in Donegal, and we did really amazing work on, actually, I think kind of rule-driven AI and decision support for patients with abdominal, pain and injuries. People like Karen Kelly, an advanced nurse practitioner in Portlaoise. Incredible results. So it was actually stimulating to work with people. Our Richard Costello, he's a leading respiratory consultant in Beaumont. But unfortunately, the culture isn't set up in the HSC for rapid and radical innovation, and healthcare is actually driven by innovation. We've made such progress in 200 years. For 30,000 years, average life expectancy mark was just under 30 years, and then something remarkable has happened in the last 200 years. Life expectancy has more than doubled, and that's been through public health measures, it's been through pharmacological interventions, it's been through surgical interventions. So the way we all get better healthcare is through innovation, but unfortunately, systemically, I found the HSE, there was a strong bias towards or against innovation. So that was really difficult. So I had to build a network outside of the traditional hierarchy of the health system to innovate. And we put in a whole new governance mechanism. It was called the Digital Innovation Solutions Board. And I took the method I'd use for Intel sort of innovation pipeline management and put it into the HSE. So the HSE actually had as good as, if not a better, innovation pipeline system than companies like Intel or Google. And a lot of people supported, but there also was a lot of resistance. So it was very difficult. And it's sad because people's lives depend on the introduction of these innovations, and we can extend lives, we can lengthen lives, and the percentage of people spend healthy we can dramatically extend that.
How excited are you about AI being applied to healthcare? Because there's not a day that goes by where I don't see some innovation that's on LinkedIn or but the use cases are starting to become very prevalent. Last year, I had Dr. Brahiba from the Mayo Clinic. I did a fireside chat for the RCSI, and they were just talking about the mindset, how they're having hundreds of these AI case studies up and running as prototypes, or trying to introduce them. And it feels like we're on this kind of tipping point now where these innovations are going to start to add so much more value to how we live. But it's also very frustrating that if you don't actually roll the dice on these and actually start to bring them into play, we're going to start to lose people's lives and we're going to actually have a worse standard of living than we had 20 years ago.
I think the comment on roll the dice is well, because it's actually not even rolling the dice, because really high probability when you roll the dice you're going to win. Edward Shortliff wrote a famous paper in 2000, and he basically said medicine is an information management discipline, and AI is just the perfect tool for that. So there are so many opportunities. I think the most valuable thing that I've seen, I talk about a strategy called stay left, shift left, 10x. So healthcare is really complex, but I believe if we have a really simple strategy for transforming healthcare, we can do it. And digital and data are the enablers, and then AI comes in and turbocharges it. So stay left's about keeping well people well, or if you happen to have a chronic condition, we can treat you best of all from home. And shift left's about getting you home as quickly as possible from an acute setting. And 10x is the notion that we can do things 10x better, 10x cheaper, 10x faster, 10x earlier. And we have so much empirical evidence of that. Now, I've been talking about when I was at Intel, 12, 13 years ago, a Moore's Law for healthcare. And when Gordon Moore announced Moore's Law, and he was very uncomfortable about calling it Moore's Law. I think it was Carver Mead, I think, coined it. But he only had 4 data points. But he set this aspiration for what could happen in the semiconductor industry, and everybody aligned around it. And that's really what I've been trying to do in the healthcare industry. And I've been collecting 40 or 50 now empirical data points where we've been using digital in heart failure, in skin cancer, in COPD, lots of other areas. And we're proving that we can do things 10x faster, 10x cheaper, 10x better. And so what we're hoping is to create this Moore's Law for health. And we have the empirical data, but get everybody aligned around the strategy. And you may or may not have heard of AJ Batt. He's nearly as important as Gordon Moore. He's the inventor of the USB. And I was telling AJ there, last year, say, hey, AJ, we're going to announce this new Moore's Law for healthcare in New York at the UN General Assembly. He said, hey, Martin, that's great, but it shouldn't be called Moore's Law. It should be called Curley's Law. So that's good enough for me. But I think the most valuable thing is digital and AI can do things far faster and far earlier. So the most important thing, for example, in cancer. So cancer is the number 1 cause of death in Ireland. It's the number 3 cause globally. But every month, the data, I was just reading some data last night, every month that you delay a diagnosis, there's a 10% increased risk of mortality. So the survival rate, if you have stage 4 cancer, the mortality rate is 95%. So using digital data, and particularly AI, to diagnose cancer early is absolutely life-saving. So this afternoon, for example, Patricia Paterlini, she's a French professor. She has a company called Rare Cells, and she's using a new, technology, but also supported by AI to detect what we call circulating tumor cells. And she's having amazing results. She's had 4,000 patients, and she has a sensitivity and a specificity of 95%. So this is really accurate, but amazing. Can you imagine if this technology was deployed, in a widespread fashion, we would detect cancers far earlier, we'd save lives, and we'd massively reduce costs. So, when I was in the HSE, I had the privilege of working with DermView, which will become AllView, and they use digital dermatology. And Owen O'Reilly is the CEO. He works with Rupert Barry, who's a dermatologist in St. James's Hospital. And today, one of the biggest shifts that they have found, so instead of waiting maybe 9 months or 2 years to get an appointment to see a dermatologist, and at that time your cancer could, grow from stage 1 to a stage 4. What they offer is the ability to go to one of their clinics. You get high quality, resolution images taken, and then there's a dermatologist panel that looks at that and then can disposition, the cancer. Maybe you don't need treatment or you need to see a dermatologist. And what they found is we can go from 2 years to 2 weeks. So you could, if you need surgery, you actually, can have that surgery in just a couple of weeks. And that's absolutely life saving. And the difference between in skin cancer, which is number one cause of death in Ireland, between a stage 1 recovery or stage 4 is about, 20x. So this is and they're now moving to actually augmenting the dermatologist panel with an AI solution. And if you look at the FDA sort of approvals for AI solutions, radiology and imaging is 80%. So AI is so suited to, particularly radiology and imaging.
And I love what you say about that augmentation, because for so many people, they think it's one or the other. But that augmentation to have so much better decisions. And I remember we've had John Sheehan, which is obviously a friend of yours, and you're telling me, it's like, the reality with radiologist is you might show him something at 9 o'clock or her something at 9 o'clock. By 5 o'clock, that person is tired. They may well give you a different decision or different interpretation than the following day if they're actually reviewing it. But having that kind of together collaboration and trying to understand it, because we're now in a relationship with AI, and people may actually underestimate that, because from an algorithm perspective, what we watch, how we got here, it's got that personalized experience, and we don't even think about it like that. So from the healthcare perspective, it's just being cognizant that you're now going on a journey with it, and you're going to start setting in the different parameters.
Yeah, and just thinking on John Sheehan, is Dr. John Sheehan, an amazing guy, and he's a great friend, but also he inspires me. But under Stay Left, Shift Left 10x, we talk about 10 Copernican shifts for healthcare. And a Copernican shift is a really dramatic shift. Copernicus came up with the view, of a heliocentric view of the world rather than a geocentric view, and that was really radical, and took 150 years for the view to come in about. But if we are to transform healthcare, and I fully believe we can create this metamorphosis, there are a number of really important shifts that need to happen. The first is from analog to digital, from illness to wellness, from doctor knows best to patients know best, but the idea of shifting from human to augmented intelligence. So Harvey Castor, he's a Texas-based doctor. He's a big advocate for this. But we absolutely know, and John will say this, a radiologist and an AI is far better than actually a radiologist on its own or AI on its own. And we have other examples. Conversa Health at Murray Brodinsky, they're a Portland-based company that were acquired by Amwell about 2 years ago. And even, 3 years ago, Murray was in my office in the HSE and Dr. Stevens, and he was saying 80% of their care is now done via automated and AI agents. And it actually frees up the doctors and the clinicians to work with the 20% of patients that really need that personal touch. And where I think AI can be really powerful. When I worked at Intel, and I had a network of innovation centers, a lady called Cindy Brazil. She was the innovation center, and our Folsom Sacramento center, the innovation manager used to say, 80% of innovation comes from a stated need. And I don't know any industry which has such compelling needs. So in healthcare, like I've identified 10 major gaps or problems, but some of the top ones are health literacy, the productivity gap, and the resource gap. And let me give you a couple of examples of how AI is closing that. So we work with an Irish company called Vox AI. It's headed by Ray O'Sullivan, who's RCSI professor.
He's
but also
CEO Nace or Klein.
That's right. He's the CEO of IVF, but also incidentally Gavin O'Duffy, who we worked with. He was with Amazon but he's one of our graduates from our National Masters in Digital Health Transformation. He's now the CEO, but we're working with Vox AI on an AI agent that can interact with a person on an individual basis and give them customized advice. And health literacy is such a modulator in terms of outcomes. Less health literate people spend 4 times more on health, they spend 4 times more in ED rooms. So that's one example. But then on the other, we have a massive resource gap. So Hippocratic AI and NVIDIA,
Yeah,
they
Hippocratic AI is a great example.
it's brilliant. They've just raised, I think, 151 million, but you could have, for example, sort of, there's a massive shortage of nurses. Like in Ireland, we cannot get, nurses, on my local hospital, Nace General Hospital, their recruitment pipeline, they're going to Nigeria to recruit nurses, and it takes a year
And
to
with
bring
Hippocratic
somebody.
AI, if you haven't heard it or seen it, I strongly recommend you go onto their website. But let's say it's 4 in the morning and you're worried that the prescription that you have is going to be counter to your medications that you're on for other health issues. You can ask this AI avatar, which is an extension of the doctor, which has your history built into it, questions, and it'll be able to actually in real time respond. Now, at the moment, there's like a second or a half second lag, so it feels a little bit uncanny valley how it engages and stops. But I would suspect by the end of this year, that lag will reduce, and you're talking kind of in real time to the avatar, which is incredibly exciting. And then let's say you call up later on the next morning just to confirm that the avatar was correct because you're a little bit worried. You can then talk to a human being or then speak to the doctor. I just think the opportunity for these digital humans are just immense.
No, absolutely. And yeah, as you said, I'd recommend anybody go on to the Hippocratic AI. Like I was interacting with our diabetes 2 nurse, and the information is so up to date, and giving real time advice around nutrition in terms of how to manage your blood sugar levels. So, and clinicians shouldn't be afraid of this. It's all about augmentation. I don't know a single clinician that actually is not overloaded. And I think there's tremendous opportunities also for GPs. So in the UK, and I have the privilege of working with the NHS via St George's House at Windsor Castle, and a couple of amazing Dr. Amar Ahmed. He runs a practice in Wilmslow, and he's one of the leading adopters of technology and AI. But in the NHS or the UK, and it's similar to Ireland, 90% of the clinical interactions, other than pharmacies, are through the GPs, and they're just 6% of the budget. And what we've seen in the NHS and also actually in the HSE, rather than a shift left of resources, shift right. Like the NHS have shifted almost 9 or 10% of their resources into the acute hospitals, and that is not the right way to go. But tools like Nabla, and I've been experimenting with that, and that's a tool, or Microsoft Nuance, which I think evolved from the Learner and Hospi speech, processing group in Belgium. They have the ability to capture in real time the conversation between the doctor and the patient, create notes for the patient, create notes for the doctors, but also start to suggest potential diagnoses and suggested remedies. So there's a great guy, Bogie Ellison, he's in Copenhagen, and he says you can't afford actually to go to a doctor that's not using AI.
It's really important because if you're not, and I couldn't believe it, 60 to 65% of doctors' time could be doing notes or administration where they're not in front of the patient. Where this allows you to have the doctor in front of you, the AI is actually taking the notes, you get to see your version, their version, so it's really transparent. And then, most importantly, it's got the recommendations for next best action to follow through. So you've got the data then and the insights. So then the next time you have a conversation with the doctor, or if the doctor isn't there, you've got your kind of clean line of sight of what's being done. So there's so many opportunities
I
for
think
doing this.
transforming, like there's so many, it's not quite 10x, but 10x in terms of the fidelity of what's captured, because doctors forget to make notes. But one thing that's really
Or you lose the notes.
yeah,
Yeah.
yeah, exactly. But patients, they, particularly if there's bad news, they forget most of what they heard. But one of the interesting things, Dr. John Sheehan has been doing is using Notebook LM Google to actually create a podcast for the patient to explain
Which
their results,
it's
and it's
which is
really
brilliant.
powerful.
And with the next version of that, you can actually interrupt the avatars and ask questions.
Yeah, it's
So when I was driving home after getting my DEXA scan, my rheumatologist has said, I'm 15 minutes behind my next appointment. I'm sorry, I'm going to have to cut this short. So what I did is I took a picture of my DEXA scan results, and the whole way home, me and ChatGPT talked through them as if I was a 10-year-old. I felt like I had a plan of attack about what to do. I knew what types of food I needed to work on. And it even talked me through a 30-day action plan in terms of exercises. And people are thinking, are you crazy? And I was like, well, you've got Einstein in your back pocket now that you've
yeah.
got access to.
And that's a really important point, because actually this device is the most important medical device of the 21st century. And this is going to open up this avenue moving from Dr. James Mountford. He's the editor of British Medical Journal Leader, and he talks about moving from paternalism to partnership, and that's one of the key Copernican shifts from doctor knows best to patients know best. But this device, I have access to my personal electronic health record. Actually, I have Kushla, and they're actually based in this building here in the Guinness Enterprise Centre. I also have access to a patient portal on the digital health spine. We've been working with building with the HSE, and in spite of the HSE, I'm taking data from, I'm wearing a CGM device on my arm, an Abbott Freestyle Libre, and that's absolutely modifying my behavior in terms of, the exercise, the food I intake. I also use the Irish Health My Life app, and I've been using that. I've been able to improve my uh, holistic health score by over 100 points, in the last year and a half. And that uses a tool from a Swiss company called Dakadu, and it's got a, holistic health assessment. So this mobile phone, this is going to change everything. And we're going to see this paradigm shift from it's all about abdicating responsibility to the doctor for health, that we really own it, and the doctor and the nurse is a partner in
And
it.
you've got the self-serve, which is so empowering then because you can feel like you're making progress towards the goal rather than you're blaming it on someone else, or that you start to take more ownership, and it's explained to you in a simplified way. And then it's from a gamification perspective, you can fill it in or you can complete it. You can have visualizations on it, so it makes it more easy on the eye as well. But the biggest challenge we have is people are reluctant to change, right? People don't want to change. They're comfortable doing what they're doing. How do we start to take an action plan to introduce this? And how do we kind of get off the, what we're used to and actually start to feel comfortable being uncomfortable?
Yeah, and I think there's thinking about a population level, and we need to talk about culture there, and then on an individual level. So one of the key design practices in Open Innovation 2.0 is called design for adoption. So you're looking at the utility, the user experience, and so on, and the ubiquity. But if you design a solution that is so much dramatically easier, dramatically better, the barriers to adoption go away. And digital and AI and data have such power. They actually can create these solutions that are 10 times faster, 10 times cheaper, 10 times better, actually 10 times more convenient. So another company in this building, Redzing, they do telehealth solutions, and it's so much easier if I can have a telehealth interaction with a doctor rather than being stuck in traffic and parking and all that. And I'm writing a book on stay left, shift left, 10x at the moment. And one of the biggest issues in Irish healthcare and globally is productivity. So just to lay out the problem in Ireland, we've added 8 billion in spending in the last 8 years. We've added 50,000 health workers. Now, 50,000 health workers, you're in recruitment, so you know what it takes to recruit that amount of people. but the net productivity has only gone up 3.8%. So Andy Grove, he was a founder of and the CEO of Intel. He had a great saying. It's a little bit rude. He said, that kind of organization or system, it eats like an elephant, but it shits like a budgie. So we have to do something different. But I'm writing a case study, Patient Empower. They're another company in the Liberties here. Eamon Costello is their CEO, and we worked with them in COVID to, co-develop a remote monitoring solution for COVID-19, but their technology was used with CF patients, cystic fibrosis patients in Galway. And also there was remote physiotherapy solutions provided during COVID. And the results were absolutely remarkable. So CF patients are very vulnerable. Hospitals are a nasty place. They are immunosuppressed. They could pick up something. So all of the physiotherapy solutions were done remotely, or most of them. And it was best for the patients. The patients actually saved €895 on average per person just on travel costs. They saved an awful lot of time. It was 10 times more convenient. They were able to attend a lot more sessions. But the productivity was 14x improved, 14 times. So by using telehealth, they actually delivered 14-fold more sessions. So this is the answer hiding in plain sight. We've got to have, radical, dramatic, very, very pervasive adoption of digital and particularly telehealth solutions in Ireland.
Please give me 30 seconds of your time. It blows my mind that only 9% of listeners actually subscribe to our podcast. I'm going to ask you one favor. If you like and enjoy this podcast, please can you subscribe? That one thing will really, really help us and the team get you the very, very best guests. Thank you so much. I hope you enjoyed today's episode. And one of the things that I think is something that I would love to look at is, if you look at your average appointments, I think it's something like between 30 to 35% of appointments are no-shows, which means that people have just wasted the opportunity to slot in someone else. And where you could use AI is where an AI agent calls you to say, just confirming that you're going to attend your appointment. There's a follow-up by a text message. The invoicing can be done ahead of the schedule. You can also have it as a follow-up with the notes emailed to you through an AI agent. Digital avatar can kind of manage all that experience beforehand, so when you get there, you don't have to fill in forms. So that can then save more time to turn things around for people.
For sure. And in this CF pilot in Galway, actually, over the period of the trial, which was funded by Sláinte, there wasn't single DNA, not one. And then there's companies like Sprite, you might be familiar with them. They're working with the NHS, particularly on cervical screening, which is really important in marginalised parts of London. The Sprite engine is actually interacting with people and encouraging them and trying to drive behaviour change to make sure women actually go to the cervical screening process. It's great for the patient, but it's also great for the system, because any cancer that we can detect early, it actually massively reduced costs. So that's a really good example of an Irish company. I think they're based in Monaghan, doing that with the NHS, and we need to be doing that in Ireland as well.
Are you optimistic?
I'm so optimistic. In fact, there's such gravitational force. So what is going to happen is we're going to have a metamorphosis. And I'm really inspired by a quote from a guy called Ilya Prigogine. He was a Russian, Belgian, I think, physicist, and he talked about Nobel Prize winner. He said, when a system is far from equilibrium, small islands of cohesion have the ability to transform the whole system. So what I've been working on is a guided, open, collaborative ecosystem, and we're working towards what's called a phase transition. I'm inspired by a guy called Josh Colchester. He's based in the UK, runs the Systems Innovation Network. And healthcare is a complex adaptive system. So what we're trying to do, and we're working with some brilliant people in the HSE, people like Maxine Radcliffe, and we've built a digital health spine, which will then allow overlays of AI agents, etc. and we are seeding pockets of usage of this platform in Ireland, and at a certain moment it's going to emerge, and this is going to be the obvious solution moving forward, and there will be a metamorphosis of a whole new kind of health system, which is person-centric, which is phone-driven, which is AI-assisted, and we're all going to live longer. There's going to be better work-life balance for clinicians. So, and I talk about the quintuple aim, the IHI, the Institute for Health Improvement. They came up with the triple aim, and that's solidly being extended. But what I've seen in the empirical evidence that I've been collecting is that we can see 5 types of improvements when we apply digital and data and AI to healthcare. First, we can improve care and outcomes. So if you can detect cancer early, for example, there's an immediate benefit in terms of care and outcomes. We can lower the cost and improve the value. We can improve the patient experience and quality of life. So a patient that's treated from home, that's wonderful, rather than actually having been able to stay in hospital. We can improve the clinician experience, and we can improve their productivity. We're working with a brilliant clinician, Professor Sean Gain, at the Mater Hospital in a project funded by Johnson & Johnson and a UK company, HCI. Richard White-Haynes is the chair. And we're working with PAH patients. And that's not a good diagnosis to have, but we're providing a digital companion to the patients, which just help educate them, but they're also reporting their symptoms. So the patients, we're hoping, our hypothesis, they're going to get better results, extended lives. But for the first time, Professor Game will be able to see actually a dashboard of all his patients, and he can see which patients are well, which patients actually need help. And he's about to introduce that as part of their MDT process. They'll actually look at their patient cohort and say, well, these 4 patients we need to look at. And then the last benefit is sustainability. So every time we do a telehealth project or engagement, we're saving maybe about 4 kilograms of CO2. So we have a very nice research project with the Royal Hospital in Donnybrook. We're working with a brilliant team there, the COO, Stephen Adamson, and their new CEO. We're using the Red Zinc Blue Eye solution, and our goal is to reduce the average length of stay for stroke patients by a third. By getting people home and remotely monitoring their vital signs and having telehealth. And that's great for the patients, but it's also improving capacity. As you know, or you may or may not know, but Irish hospitals are the fullest hospitals in Europe. Our average occupancy is running at 97%, but some hospitals run at 103 or 104%. So if we can take somebody out of hospital a third of the time earlier, it frees up a place for another person who might have a more acute need. So we can hit these 5 benefits. So it's actually almost miraculous. It's the gift that keeps on giving.
We just need to reimagine how we've come to solving problems before, and actually think, okay, this is how we can now look to do it. I think AI literacy is going to be very, very important, that we go on this journey and let everybody know what's happening. I spent a little bit of time in Finland recently, and from such a young age right through to people who are elderly, they are learning about AI across how it's been adopted, the challenges with it, the bias, the benefits. So then people become so much more comfortable with it, and then they feel empowered to go on the journey. And I feel at the moment, we're not spending enough time explaining it, the full composite about the challenges, benefits, and just talk about as a society to move forward.
Just a couple of really important points you made there. So we need to, and I struggle whether I say reimagine or imagine, but it's imagine, architect, and engineer our health systems. So if I look at health systems, they've just evolved by osmosis, and the techniques. I worked at Intel. We built semiconductor fabs. I was the automation manager for some. Developed the automation solutions with colleagues when I was based in Phoenix, and the technologies that we put in place 30 years ago still aren't in place in modern day hospitals. So it is reimagining. It's then architecting and engineering. So this role of health architect is going to become increasingly important. So that's the first piece, and that's kind of top down. And then the second piece, which you're getting to, as I look at the top 10 problems in healthcare, the top 10 gaps, productivity is massive, resource, but health literacy, I think it's number one. And the more and more I think about it, and one of my colleagues and friends, John Shaw, he's the CEO of Carillon Global Solutions Ireland. They've 300 people working in AI in Limerick, and we work with them at Maynooth University. But he says people will look back in the future and say, my God, in 2024, what were people thinking? We know more about our cars than we know about our own health. So everybody should know, what are their blood pressure numbers? What's their, glucose numbers? Like, we have a cancer epidemic, and increasing the thinking on cancer is it's not actually genetic or germline. It's actually, somatic, and it's behavior and environments. And, I was recently actually, John Sheen and I were at Windsor Castle on a workshop, and John was talking about actually glucose is a really key problem in terms of driving inflammation and a key driver of cancer. So everybody should have closed loop digital control for their blood glucose level, and just knowing about the nutrition and what you should and shouldn't be eating. It was really interesting. I was interacting with the Hippocratic AI, the diabetes 2 nurse, and the information is spot on this, because there used to be the food triangle and this was the Bible, but there's some stuff and that's frankly incorrect. But if you're pre-diabetic or diabetic, there's some things you absolutely, and food you should be eating and food you shouldn't be eating. And if you have an AI agent that's giving you that information. So I think the literacy, and so there's health literacy and then there's digital literacy, and I see AI literacy as just a subset of digital literacy, because I think, the interactions with AI are just going to be conversation. It's going to be like you and I talking. So I don't think there's anything particularly specific around AI literacy. It's just about basic digital literacy. But I'm inspired. We worked with amazing lady. She's in her 80s, and she did a lovely video for me, and she talked about how she was able to use her Fitbit and an AliveCore device, which is a small device fits in your phone for detecting ECG analysis, and how she was able to detect with her GP, she was able to diagnose supraventricular hypo or tachycardia. And she'd been through all sorts of tests, with cardiologists and hospitals, and they weren't able to figure out the problem. But this was potentially life-saving. She produced a wonderful video. She's the mum of Aisling Gannon, who's another one of our graduates from the master's program. She said, I hate the term geriatric, but here's a really good example where me, a geriatric, was able to use my mobile phone, a Fitbit, and this digital health device, and were able to figure out my diagnosis, and it was potentially life-saving. So a lot of people say, older people can't use the digital technology, but they can. And my dad's a really good example. He's a wonderful man. He's now 90, but just a funny story, during COVID, he got a text, on his phone, and, he's able to do an antigen test himself, but from the HSE, Brendan Curley, 87, 88, you have COVID. And he said he wasn't shocked at the COVID tag. He was shocked he was 87 or 88. But older people actually have every ability to use these technologies, and it's just basic literacy. So yeah. I'm really optimistic. Yeah. I'm really, really hopeful.
And having that dexterity for all is just so much more inspiring. If you're looking back on your life, what will you have been happy you've achieved?
I'm always inspired by Robert Kennedy, and he talked about the purpose in life is somehow to make things better. So that certainly would be a key driver. I'm so blessed to have 4 wonderful children, and that's kind of just an amazing gift to have, and to see them prosper. That will be something that I'm so proud of, and hopefully they can go on and have wonderful lives and actually make a difference. But I've always been driven by purpose, and the ability to make a difference, and you don't always get it right. But for me, it's about purpose, it's about progress, it's about people, it's about passion, and then that can lead to profit. And when I was at Intel, again, I mentioned Paul Ottolini, who sadly passed, away, and some of the technologies that we talk about or are using could have saved his life. So, if we can save one life, I'm working with, wonderful people like Karen Kelly and Richard Costello and John Sheehan and R. Ahmed. I work with, people like Will Jansen in New Zealand. So, I learned a big lesson at Intel, really important lesson when we were working on Intel Fab 14. I was the automation manager, worked with some great people like Peggy Landers and Joe Kilgannon and Pat Hickey. But we set a goal. This was the biggest construction project in Europe at the time, and statistics said we were going to have a couple of fatalities during the construction. But we set a goal of an injury-free startup. And we worked with a company called J&J Associates based in Chicago, and the lesson I got from them is relationships are the foundation of all accomplishment, and in life it's all about the relationship. So an open innovation 2.0 is about high trust and high capability. So it's all about working with great people and nice people to make things better.
Martin Curley, thank you very much.
Thank you, Mark. A pleasure.
Hello, my name is Mark Kelly, founder of AI Ireland. We're passionate about collaboration and sharing the incredible stories behind every AI journey. That's why we're always looking for guests to join our in-person AI Ireland podcast experience. If you're working on innovative AI projects or have a story that can inspire others, we want to hear from you. This is your chance to share your insights, experiences and ideas with a really vibrant community that's as excited about AI as you are. So if you're ready to be part of this conversation and help shape the future of AI in Ireland, please get in touch today. We can't wait to collaborate with you. Thank you.